print out a table that has all of the treatments and side effects.
Has AI came to your sector, and how, because people are using some tools for social isolation. So how are you implementing AI within your organization, and what you're seeing, what kind of AI tools are being used across your sector and in supporting mental health outcomes?
Sure. I know we've got it on our topic for our staff board planning day. And we're facilitating, got an external person facilitating a workshop around culture, because culture is important, and how does AI fit within your culture. I have seen it used really effectively in healthcare. Neurologists are using it, Amber's neurologist uses it to actually note take, but also look at symptoms and plotting symptoms and patterns. And so I think in healthcare it could actually provide a lot of assistance with analysis of the different symptoms and conditions, and also even I've used it myself. Amber's had so many medications and so many side effects, so I was able to put all those reports in and then print out for her new neuropsychiatrist, print out a table that has all of the treatments and side effects. So it can be very useful for treatment and for tracking, and I see potential of it. I know it's being used a lot to cut down the administrative workload. I know I use it for that because it gives me more people time, and I'd rather invest into people time. So I use it for everything from doing board minutes to, and a lot of us are doing that because we see the value of having more time for people.
Somebody used this term who are using AI in the frontline care sector. So hold the hand, not the pen.
Yeah.
So you're spending more time instead of writing case notes or session notes, you're doing more care work.
Yeah, absolutely. Amber's neurologist certainly has been using it for that, for more time with patients. I wholeheartedly support it. I think if it can cut down admin time for specialists and they have more time with a patient.
Yeah. As you see the evolution of, we are being exposed to more mental health conditions as we go, and then more, again, the whole spectrum keeps on expanding on mental health. And more conditions being identified and all of that. So how do you see what are the causes of these expansion of conditions? How's the spectrum looking like? And then what's your observation on those?
It's interesting, isn't it? There's actually a bit of a movement happening at the moment. I'm doing some work with Macquarie University, so we have a couple of partnerships, and they have the Wellbeing Lifespan Centre. And there's a bit of a movement to try and more or less, it's probably not the right wording, but let's just say even just start again with the diagnostic manual, the DSM. Because a lot of us think that putting a person into a pigeonhole might not be that useful sometimes. And often, as I said, the label comes first before the person. Sure, don't get me wrong, sometimes it can be helpful for people to pinpoint and know what their condition is, to understand it, so it has a place. But a lot of us feel that labelling is often used, and people, sometimes, I hate to say it, even psychiatrists, get behind the label rather than thinking outside the box, being a bit more lateral and thinking about what else might be happening for that person.